Hi, I'm Parminder. I'm the director and principal physical therapist at Move Physio. Today's topic of discussion is mental and physical well-being of children during the COVID-19 pandemic. All right, so let's start with the mental health or mental well-being of children during this pandemic. Um, so depression, it's very commonly seen in children and adolescents, and it affects like 50% of them by the age of 14, and nearly 15% of adolescents and children are affected with mental illnesses. Okay, so this COVID-19 has increased this percentage because there are many changes happening around us, and schools are closed. The classes are happening online now. The kids are not able to meet their peers, meet their teachers. So all this this new normal, which is kind of can be stressful and can be a bit abnormal for them, um, is leading to kind of mental illnesses in kids. So the various kind of mental illnesses which we can observe in children are panic attacks, anxiety, depression, PTSD, which is post-traumatic stress disorder, and other kind of mental illnesses. So it has been found that worldwide 67.6% of children, they have been affected, their education have been affected because of COVID-19 pandemic. And this is kind of serious, and this statistics is over 143 countries. So yeah, it's a kind of a serious problem for children, and we need to see how we can help them, how we can connect them with the professionals, and how their schools can provide them good environment, and again counselors can help them, psychiatric help if they need any. We can connect them to those services. So they need a good environment so that they can improve their mental health and can overcome all these traumatic incidences which are happening around us. All right, so this COVID-19 pandemic has actually disrupted the lives of parents and children, because they are no more living their normal lives. They are mostly homebound, and the school environment is quite effective for developing brains, because they kind of grow, they learn, share their emotions, and interact with the peers. So all this is like very important for developing brains. But now, as these things are not happening, so their brain growth is kind of affected. Besides that, their learning, their development is getting affected. So yeah, it's very important for us to not ignore all these things, and take care of their mental health, and how we can bring them the environment at home, how we can help them to whatever they're missing, we can still provide them using some other tools and activities, etc. Also, children are exposed to various stressors, like they might be separated from their families, friends. They might have seen a kind of an ill person in their family, or even death. They might have seen somebody dying in their family, or even they might be thinking of their own death, because everything is kind of happening around us. So it's quite serious, and yeah, so all these stressors are for kids. But besides that, the parents or the parental mental health is also very important, because whatever parents are experiencing, whatever their mood is changing, their mood changes are actually going to affect the children in the family as well. So there are various stressors for parents as well, and based on those stressors, they might have to like deal with those stressors or develop some kind of strategies so that their own bad mental health should not affect children's mental health. So the stress of parenting is a big one because kids are mostly homebound and parents have to take care of them 24/7, so which is quite stressful. And then work from home kind of stress. I'm seeing many patients who are experiencing many aches and pains because they have to continuously sit for hours and hours. So again, that's like you have your own physical pain, and then you, on the top of it, you have to take care of a kid or kids, so that can be quite mentally draining. And then financial uncertainties. People are losing their jobs, so that anger or frustration is there in people, and they might take all those things on kids, which should not happen. But yeah, so people have to be they have to be aware of their own mental health so that they can take care of it, and how they can put a barrier so that their own emotional reactions should not affect the children in the family. So they are also worried about keeping everyone healthy, healthy diets, etc., self-care. And also some people who are like parents who are kind of frontline workers, they are kind of exposed almost on daily basis to COVID patients. So there is a kind of, again, panic, anxiety in them that they might catch it, and again their kids might get it. So it's like we need some kind of counseling there as well, and we need some kind of ways to take care of our mental health. Alright, so one major advice which can be given to everyone is not to watch news channels for a very long time, because the social media or news actually affects our mental health, and we start to feel more and more anxious, depressed. So limit that. That will be helpful for your kids and children as well. And also exercise regularly, eat healthy, do some kind of exercises, yoga, meditation. In our last session, we mentioned about 150 to 300 minutes of moderate level of exercises for adults. So they have to do it in a week. So that is recommended. So if you can do some kind of activities, so that will be helpful. Sleeping properly, avoid alcohol or drugs. Have a structure in your day. So again, it will be helpful for your children and for you as well. If you have a structure, if you're getting up late, sleeping very late, so it again affects your physical health and as well as the mental health. So have your food on time, sleep on time. Help your children in processing the pandemic related information. So there is so much information going around, and they might be confused. So you might have to sit down with them and discuss things with them, what is it and how we can deal with it, what all things we have to be careful of, and how to follow all the guidelines. So yeah, talk with your children and discuss, and if they have any kind of trouble or emotional things going on, you can again help them out there. So also, if the condition is quite serious, like if they are feeling too much sadness or anxiety or any kind of hopelessness, sleeping or eating disorder, or feeling out of control, you might need to meet a counselor for their mental health. So yeah, please take a good observe your kids nicely and see if they're experiencing any of these signs and symptoms. And also yeah, academic delays are combined with psychological and social delays. So you have to take care of things now. And so what you can do, after the mental health, the physical health is very important. So by adding some kind of activities or by structuring their day properly, you can give them a good mental health or help them there. So again, 60 minutes of moderate level of exercise in a day is recommended for kids and children. and this can involve a lot of short bouts of activities of various intensity. So you can think there and discuss with the children like what they want to do. So connect with them and whatever activities they are interested in, try to do with them and engage them. So reduce the screen time. That is very much recommended, because again that is not good for mental health and physical health. And physical health is very much linked with the mental health. So if the kid is like sitting all day long and very much sedentary, it can actually affect his mental health. So what kind of exercises can be added? So there can be some exercises which affects or actually stresses the muscles and bones, like jumping, yoga, or some kind of aerobic exercises. And then the movement skill exercises, some kind of balance, coordination, and body awareness exercises. Okay, and besides that, so what are the benefits of doing all these physical activities? They improve the mental health, they improve the cognitive functioning. The kid may be able to solve all the problems, math related or any other subject related, much faster if he's more active. If he's just sitting all day long, he might be more dull, and things might get boring for him soon. So besides that, it increases the self-esteem, it reduces the chances of depression in young people. Okay, so that's your job, to motivate them to move more. Okay, and there are certain exercises or activities which you can do with them. So like play hide and seek, skipping, balloon volleyball can be played, then learning to juggle or learning to play any kind of instrument, and then exercises like burpees or jumping. So you can ask them to create their own exercise plan for 5 to 10 minutes. Okay, don't stress them too much, but yeah, although these physical activities will actually help in improving their mental health as well. And if you still feel like they need some kind of a professional help, then do seek that. Do not ignore any of these signs which I have told earlier. So yeah, it's not normal to feel sad or anxious or hopeless. Yeah, so it's not new normal, it's kind of abnormal. So if you think the child is experiencing all these signs, so yeah, do consult a counselor or physician, psychiatrist or psychologist. Okay, and besides that, yeah, sometimes it's it's not always kids who are stressing out the parents. Sometimes it's the parents. It's a parent who is who is stressing out the kid. So because you're interacting with the kids all day long, so try to learn some new ways or new techniques. So if you're feeling angry, frustrated, or overwhelmed, try to take some time out and go to the other room. So do not shout or yell at your kids, or express your frustration on them. And whatever physical activities you plan to do, again, you can encourage them to discuss those things with you. You can connect them with their friends, because we all are kind of isolated in our own houses. So yeah, you can do the FaceTime, or you can call your, his or her friends, so that they feel more psychologically and more better. So yeah, so this is all about the physical and mental health or mental well-being of children during the COVID-19 pandemic. I'm not a mental health professional, but if you need any kind of help from us, we can definitely connect you with a specialist or a professional. But otherwise, for the physical well-being, we can definitely plan exercises for the children, and we can help them out there. So you can call me or you can email me. The contact information is there on my website or FB page. Yeah, so this is it for today, and hopefully I'll meet you soon again. Have a great night. Thank you. Bye.